Hello everyone, welcome to sqadia.com, and in this section of our lecture, Endoscopic Surgery in Gynecology, we will talk about hysteroscopy. We will talk about hysteroscopy procedure, what's the diagnostic and operative hysteroscopy, and also what's the level of hysteroscopic procedures. So what's the hysteroscopy? Hysteroscopy is actually the visualization inside the uterus. Scopy is visualization and hystero is used for uterus. So visualization inside the uterus. So hysteroscope is inserted through vagina into the uterus, and then inside of the uterus is visualized on the screen. So in this you can see the inside the uterine cavity. These are the two tubal ostium inside of the uterus. This is one tube ostium and this is the other tube ostium. So this is the inside of the uterine cavity, panoramic view. And then this is the inside the uterus again. This is the submucous fibroid. If inside the uterus submucous fibroid is present, it appears like this. So this is the two pictures obtained by hysteroscopy. This is the patient laying on the back, and hysteroscope is inserted inside, and it can be viewed here. The instruments used in hysteroscopy, we have resectoscope. This is resectoscope with an angle cutting loop. Resectoscope here, and then this is the hysteroscope instrument inserted to visualize the inside of the uterus. And then in this picture, this is the hysteroscope with working element for our operative intervention. This is the hysteroscope that can also perform some operative procedures. So simple hysteroscope and hysteroscope which is equipped with the elements used for operative interventions. Again, this is the picture of hysteroscope. Here we have the light source. This is the operating port through which the instruments are inserted to perform different procedures. This is the inflowing tubing and outflowing tubing. So for putting the gas in and out, outside, taking it out. And this is the grasper entered through operating channel here. This is the instrument to remove any tissues. So for biopsy or anything, this is the grasper entered through that operating port. This is again the pictured little detail of the hysteroscope. Again, this is the hysteroscope. This is the vaginal speculum. So speculum is inserted first to keep the vagina open. So it can be hysteroscope can be inserted easily through the vaginal speculum into the uterus here, and then through the light source doctors can visualize inside. So there is a syringe, vacuum syringe going in. This is the vaginal speculum. So hysteroscopy procedure, this is the in this picture, if you see, this is the hysteroscope or instrument inserted through the cervix here. And this is the cross section of the uterus. You can see fallopian tubes, ovaries, uterus. These are some polyps attached inside the uterus. So here you see this polyp, this is the polyps. So through the hysteroscope you can visualize the structures in the or growths in the uterus. Then again vaginal ultrasound through the vagina here, abdominal ultrasound. Then view through the hysteroscope inside the uterus, you can see view through the laparoscope. This is hysteroscope through the, and this laparoscope from top. This is also polyp or growth. So what are some indications of diagnostic hysteroscopy? Diagnostic, when we use the hysteroscopy or when we see inside the uterus to find out the different abnormalities. So first, we use it for abnormal uterine bleeding, menorrhagia, or postmenopausal bleeding. So any disorder that's causing uterine bleeding, we do the diagnostic hysteroscopy. Then it is also used for infertility, any Mullerian anomalies, recurrent miscarriages, any misplaced IUD. Sometimes when IUD, intrauterine device, is inserted, it gets lost. The thread is not there, so it gets lost inside the uterus. So hysteroscopy is performed. Then chronic pelvic pain, to find out any transformation zone, if it's if there are any changes in the transformation zone, and hemangiomas, which are the tumors small in the blood vessels. So all these different are the indications for diagnostic hysteroscopy. Abnormal uterine bleeding, if there is recurrent miscarriage, and to find out what can lead to or what's the cause of these recurrent miscarriages, laparoscopy can be or hysteroscopy can be performed. And then to find out the cause of pelvic pain, to find out if there are any adhesions or scars, or again to find out if there is any endometriosis or masses or tumors or growths, polyps inside the uterus. This is the picture of intrauterine fibroids through the hysteroscopy. Then again, some indications for operative hysteroscopy, which is polypectomy and myomectomy, to remove the polyps or to remove any fibroids. Hysteroscopy, operative hysteroscopy can be performed. Lysis of intrauterine adhesions, if there are any adhesions, those can be removed also. To do endometrial ablation and endometrial resection, especially if there is endometriosis, and then endometrial ablation is used, or if there is any endometrial hyperplasia, endometrial ablation is performed. So all these can be are the indications for operative hysteroscopy. Then any removal of foreign body or removal of intrauterine device, to remove the tissue for biopsy, to open up the fallopian tubes, tubal cannulation. In this, again, dye is inserted through the hysteroscope, and if the dye comes out of the fallopian tube, it means the fallopian tubes are patent and they are not blocked. So that's also performed, and tubal sterilization is also performed if there is sterilization is required. And then laser coagulation to stop the bleeding or perform to cause the coagulation or formation of blood clot. So all these are indications for operative hysteroscopy. Pre-treatment evaluation and protocol for operative hysteroscopy. Usually it should be performed, preferably be done in the post-menopausal phase with normal size uterus. And usually should be preceded by diagnostic hysteroscopy. Diagnostic hysteroscopy should always be a part of pre-treatment evaluation to find out whether surgery is required or not. And then pre-treatment with usually with danazol, gonadotropin releasing hormone analog, or progestogen for 4 to 6 weeks to make the endometrium thin prior to endometrial ablation. So that's also pre-treatment requirement. If procedure is performed on the endometrium, and if there is endometrial hyperplasia, then it's better to use danazol and progesterone for 4 to 6 weeks, so endometrium can thin out and then procedure can be performed easily. Then what are the different levels of hysteroscopic procedures? It can be divided into level 1, 2, and level 3. In level 1, diagnostic procedures are performed. In level 2, minor operative procedures. And in level 3, complex operative procedures. So in first level, diagnostic procedures include diagnostic hysteroscopy, in which usually the target is to remove the tissue for biopsy. So hysteroscopy is very, very commonly performed with the aim to remove the tissue for biopsy. That can be used as a diagnostic steps to rule out any malignancy or not. Then removal of simple polyps, if they are present, that can be also done. And then removal of IUDs. Then minor operative procedures in level 2, which include fallopian tube cannulation, and then the Asherman syndrome, which are the formation of adhesions that can also be removed, and then removal of fibroids and large polyps. So these are all included in the minor operative procedure. Then in the complex operative procedure, there is, if there is any uterine septum, that can be removed, major adhesions or Asherman syndrome, and if there is transcervical resection of endometrium, that can be done, and if there is any leiomyoma, that can also be removed. So all these are different levels of hysteroscopic procedure. Level 1, in which just diagnostic procedures are performed. In level 2, minor procedures are performed. And then in level 3, little advanced procedures are performed. So that was all about the hysteroscopic procedures and then different levels of hysteroscopic procedures. Thank you for watching sqadia.com.